Hello and welcome. This is Dr. Karen Levy from KB Holistic, and I wanted to spend a few minutes talking to you about urinary incontinence in adult women and an exciting treatment option that we have available to many women who suffer with this problem. You know, there are different reasons for urinary incontinence. Some of the more common reasons are weakening of the pelvic floor muscles following childbearing. They can also happen as a result of aging with decline in estrogen levels, so that there's a weakening of the tissues, particularly the connective tissue that supports the vagina and the urethra, leading to leakage. What's really amazing is that we now have a treatment option called the Oshot, which is biologically based and works with your anatomy. It doesn't cover up the symptoms, but it actually gets to the core of what's wrong with the tissues to help rejuvenate. But let me just back up and say that there are some women who do have severe forms or complete urinary incontinence, and for them treatment options are probably best with surgery and with medications. But the vast majority of women who have urinary incontinence have less severe forms where they have stress incontinence, where if they cough or if they laugh too hard, they're leaking urine. They go to the gym, same thing. They're jumping up and down, and there's an embarrassing moment for them. There are other women who just have what's known as urgency incontinence, where suddenly there's this severe need to go to the bathroom immediately, and right at that moment, they can't hold their bladder. So this can become a slight problem. It can be something that a lot of women actually experience, and for whatever reason they don't go to their doctor, they don't want to talk about it, they don't want to really admit it's happening. And then with time things can become more severe, and women find that they're planning their whole day around, getting from point A to point B in their daily routine, trying to figure out if there's going to be a bathroom there so they can make it. Things can become problematic enough for women that it actually affects their intimacy in their relationships. Now, typically in conventional medicine, the first line of treatment is to offer medications, and in a severe case this may be reasonable, but a lot of women don't have symptoms that are so bad that that they outweigh the side effects of these medications. You can have dry mouth, you can have heartburn, you can even get palpitations, and you can get cognitive problems so that you have trouble with memory. And so this is not something that a lot of women are going to be able to tolerate very well. There are other options, and there are other things that are suggested. The famous Kegel exercises to strengthen the pelvic floor muscles, abstaining from caffeine, but these things really don't get to the heart of the problem. They don't really change the underlying anatomy. And so that's what's really exciting with the Oshot, because it really changes your anatomy. It actually helps you rejuvenate and improve your anatomy, so your bladder basically will work better. Now, the Oshot is well known for its effects on the vagina, and with stimulation and with physiologic effects of arousal, and of course with orgasm. But the Oshot is a little less well known for its effect on the urinary system, and specifically urinary incontinence. So this is just a wonderful thing that women have, and I wanted to go over basically what the procedure is about. First of all, it's a relatively short in-office procedure. What we do is we use a very heavy-duty numbing cream that go into on the female anatomy, and then we draw about 4 tablespoons of blood, and then we place it in an FDA-approved centrifuge. And what happens is the blood actually will separate into predictable layers, and we can actually go in and then harvest that layer that contains the platelets, and the platelets have within them a potential for healing. Those are then concentrated and injected back into the tissues after a little tiny nerve block. Most women experience little to no discomfort in the procedure, and the wonderful thing is that some women will actually see an improvement in their urinary incontinence symptoms immediately. Other women, it can take longer. Everybody's individual. And with this kind of procedure, it's hard to gauge what each person will will experience, because it really works individually with each person's unique anatomy. At KB Holistic, we do place a lot of emphasis on dietary and lifestyle choices to help you improve the outcome of your procedure. When appropriate, we check hormone levels, and we also offer some complementary therapies that we believe enhance the effect of the PRP, including ozone and LED light therapy. We offer a very relaxed atmosphere with one-on-one treatment in a country setting. If you would like more information about our PRP procedure, specifically the Oshot, please contact us at 305-505-0455, or please write to us at info@kbholistic.com. Thank you very much. Bye-bye.